we have this group here with me. You know, we have very handsome, pretty-looking people in this table. So, and I'm talking about Roger Milliner. You know.
You're so generous.
But you know what? We're gonna just go down the line. I want everybody to introduce themselves very quickly. I wanted to do something different too. There's a bunch of New Yorkers here in Puerto Rico, right? And I wanted to incorporate in my workshop, an individual and an organization from Puerto Rico that participates in the OTC program. So, I'm very proud that in our group we have somebody here from Puerto Rico. So we're gonna go through the list. I'm Steven Rivera. I've been in healthcare for 30 years now. I know I only look 31, but 30 years I've been here. Many of you have worked with me throughout the past. We've seen each other grow in this industry. So I'm very lucky to have two families, right? My own personal family and my healthcare family, right? The industry has been very good to all of us, and we're gonna have a great conversation today about OTC and grocery benefits and how it impacts the community health. I'm gonna turn it over to Dr. Paul Talaj for his introduction.
Hi, everybody. Good morning as well. Dr. Paul Talaj, General Surgeon, New York City. I serve as Chief Medical Officer for both Century Management Solutions with Stephen and for SOMOS Innovation healthcare company in New York City.
Good morning, everyone. I'm so glad that this is a fun panel because this is my first panel that I'm participating. So, first of all, thanks for the opportunity to be here. I'm very proud to say that I am part of the biggest pharmacy network in Puerto Rico. It's called Alivia Health. We have 5 lines of business where we serve patients from pharmacy perspective. I'm the relationship director for the company, so I work directly with medical health plans to be sure that these kind of initiatives are well implemented. And if not, we work in collaboration, so we work together for the well-being of the patients we serve. So thank you for the opportunity.
I got one.
Sorry.
Hi, guys. Nemesio Ortiz. This also marks my 30th year in the industry. Current state, I am the principal and owner of Gamma Care Corporation. We service about 61,000 Medicare beneficiaries in the New York City market. Fun fact, I was actually born in Puerto Rico. I went to New York when I was 6 years old. I come every year, 3 or 4 times a year, so you have 2 people from Puerto Rico here. I was born in Guayanilla, which is on the other side of the island. I come on a regular basis, and looking forward to a very interactive discussion. On top of having those 61,000 members, I also run a consulting company. One of my clients, you guys probably know, Steven Rivera, one of my main clients. And my other bigger clients is actually SOMOS Community Care, which I do a lot of work with them. They have approximately 1.1 million members, well? 2.5. 2.5 million, whoa. I'm not a good consultant.
I'm looking for a new consultant.
And the last fun fact is Stephen found that picture. That's like 10 years old and stuff. That's when I was working as the Vice President of Business Development for Health First. Life's rough on the entrepreneur side. It's a little bit more tougher, more challenging. You age quicker. But looking forward to a fun discussion. Thank you.
10 years old in that picture?
That was 10 years ago. And lastly, this is my natural voice.
Remind me never to sit after Nemesio again with that beautiful voice. Have to come after that. We need to switch seats next time. Good afternoon, everyone. My name is Roger Milliner. I'm the Chief Growth Officer at Metro Plus Health. I've been in the industry, I don't want to say I'm the grandfather of all of this, right? 38 years I've been in the healthcare industry. So I started out as a rep and progressively made my way up the industry. I work alongside with these 2 guys on the end. So Nemesio, I'm not one of your clients, but we work together through his brokerage agency, and then I've known Steve forever in this business. We serve over 700,000 members in New York City. We're a local plan, we're not a national plan, so we service the New York City area. We're going to be expanding soon to Nassau, Suffolk, Westchester, with about 700,000 members in multiple lines of business: Medicaid managed care, Medicare Advantage. We're on the ACA, so anybody who gets the insurance through the Affordable Care Act, and many other specialized lines of business. So I'm excited and happy to be here and honored. Thank you, Stephen.
Well, we're going to get into the juicy part of this presentation. So I'm the owner and founder of ProHealth Connect. I know many of you say, wait a minute, isn't he also the owner and founder of Sentry? Yes, so I do transportation as well. But when I got into healthcare about 12 years ago, about 14 years ago now, when I was working for a company called Health Plus, I had to compete against my former company, Health First. I had to come out with something unique and different just to bring out the market and gain as much enrollment as possible. So I found a small company that gave me an opportunity to create an OTC card. This OTC card, when we launched it in 2011, became a phenomenal tool. And when I say a tool, it became a tool where it allowed for health plans to engage the community and say, hey, there's a benefit that's going to allow you to make your choice when you want to, how you want to, go into a pharmacy and purchase your over-the-counter products. From 2011 to now, 2025, that OTC benefit has exploded. It went from now OTC products to groceries, to paying your bills, to buying pet food, getting gas, paying your rent. And it all started in 2011 because I just wanted to compete against Health First. And in 2014, I said, wait a minute, this little card is going to be a phenomenal tool. And that's when I decided to kind of go on my own. The first company I created was called OTC Mobile Stores, which was a pharmacy on wheels where we had trucks going out to the community and basically meeting the seniors at the senior centers, at the hospitals, and just letting them know, hey, before you go to your pharmacy, and I'm sorry, shop with us, right? Because everything in here you can actually purchase because we know what you have access to. And that went from 2014 to 2020. And then that's when I decided, you know what? I didn't want to be a retailer. I wanted to expand my OTC business more. That's when I created ProHealth Connect. And I then created the technology to allow and to bring on a larger network, which was the bodegas, the supermarkets, and the independent pharmacies. So ProHealth Connect, we had to create the technology first. And we created it in 2021. And that technology now has us in over 10,500 stores across the United States, all 50 states, Puerto Rico, and also the U.S. Virgin Islands as well. I see that. Our program basically allows for the senior to use the card provided by health plans such as United Healthcare. Their members utilize this ProHealth Connect on a national level, and their members are able to go into any of our retailers and use that card and purchase over-the-counter products and groceries. And what we found is that what we focused on was independent retailers. So my company, we don't focus on Walmarts. We don't focus on the large chains. We focus specifically on the small independent retailers. And why is that important? Our independent retailers have been in the community for generations, taking care of families. They're more personable. When you walk into that location, the pharmacist, the clerk, they know who they're dealing with because they see them quite often. Even in the supermarkets. Guess what? When you speak to a supermarket owner, they will tell you, I see that senior at least 2 to 3 times a week. Guess what? In healthcare, we wish they go to the doctors at least 2 times a year, right? So I found that it's important that I had to get the supermarkets, even the bodegas, involved. Why? because a bodega is the only place where you could still go to and say, I'll pay you next Friday, and they accept it. Try that in Walmart. They'll call that stealing. What do you mean? You'll pay me next week. That doesn't happen, right? So one of the things that we focus on is that we really make ourselves a community-based program. And it's so important because under ProHealth, we provide the technology in many different ways. We give them a terminal. We give them access through a POS system integration. Or what we've just recently done is that we tell them, hey, we created an app. So now they can just put it on a tablet, on a cell phone. We try to make the lives of the local retailer as easy as possible. And when they want to join our network, we want to make that a seamless process. So now, when they join us, it literally takes 2 to 3 days to receive access to a terminal or to an app. An app is actually even faster, but if they want a terminal, they receive it within 3 days after they enroll with ProHealth Connect. And that's the key. And for those health plans that are here, they understand how important that is. So when you look at ProHealth Connect, the reason why we're saying connect is that we wanted to make sure that the members are connected into the community correctly. And what does that mean? That means supermarkets, bodegas, pharmacies, e-commerce, farmers markets, corner delis. We don't care how big you are. What we care is where you're at in the community. And that's the difference we want to make. So yes, and I want to thank elected officials, especially that are out here in SOMOS. We are looking to pass a bill next year in February. Bill is 1097, and it's called Use It or Lose It. And this is going to mandate that all local retailers have an OTC machine. And that OTC machine will be ProHealth Connect. And we're going to train and ensure that all the local retailers have it. Why? You know, we see what's happening with EBT. Guess what? This is a great supplement. People are not going to have access to EBT, right? Right now, you know, we spoke with Dr. Ramon Talaj just minutes before entering, and right now he's out there giving out food. He's giving out food because people don't have access to EBT right now. Guess what? This is when the health plans and what they're providing to their members is huge. You know, there are certain health plans that are providing their essential plan members with an OTC benefit. Not every single health plan is doing that. Guess what? We want to make sure that the plans are giving even the essential members access to OTC. Listen, every dollar counts, as we say, right, in this world. Talking about dollars, this year alone, ProHealth Connect, over $271 million have gone through our independent retailers this year, just from January to October. We've been around now for 4 years, so we're talking about billions of dollars now being funneled through our independent retailers. Now, fun facts about that. Do you know that every time you buy at Walmart, only 30 cents stays in your community? But if you shop at a local retailer, guess what? 62 cents stays in the community. What did I miss? Oh, here we go. That means that this year alone, because ProHealth Connect has built a network of independent retailers throughout the United States, about $185 million stays within that local community. That allows for those retailers to build up their business, continue buying the products that the community needs. A couple of years ago, this was only being funneled to the big box stores. Little by little, every month, we increased by 4% in our sales in independent. How does that happen? Access to more independent retailers and more knowledge. So health plans, United, Metro Plus, or you health plans that are here, Centerlight, you gotta push and tell your members independence. Why? Because you get your enrollments from the independent locations. You don't get it from the CVS. You don't get it from the pharmacy, from the Walmarts. You get it from the supermarkets, from the C-Towns, from the Bravos, right? From the local pharmacies. So do me the favor. Get the message out. Tell them to use independent retailers, all right? You rely on the independents for your enrollments, so make sure you tell your members to go back to the independent retailers. I wanted to kind of rush through this a little bit because I wanted to get the crowd involved. I want to get our panel involved, right? But some of the key benefits around the OTC benefit in regards to what it does in healthcare, what it does in the community, is just it promotes self-care and preventive health. It increases access to essential health and nutrition resources. It addresses social determinants of health, support chronic disease management. It reduces healthcare costs, enhance member engagement, strengthen local communities, and promotes equity and inclusion. I just gave you 8 strong bullets as to what you considered an OTC benefit that maybe your mother, your grandmother, a family member of yours gets every month. And you're like, wait a minute, okay, it's $200 a month. Okay, I just told you exactly what that $200 actually does, beyond just allowing them to purchase Tylenol or a box of cereal. It does a lot more. And that's what we're going to talk about, and that's what I'm going to give our panelists today. Look at this handsome guy up here. Jesus. A surgeon. Look at this guy. We want to touch on points that make sense. So I'm going to turn this over to Dr. Paul Talaj. As you can see there, not only is he a surgeon, but wait, like plastic surgeon, or, you know, like, can you change?
Very common question.
Can you change this face here for me? He's Chief Medical Officer of SOMOS Innovation, and also Dr. Talaj is also Chief Medical Officer for Century as well. Paul?
Yes. I think Stephen just addressed several of the benefits of the OTC benefit and also the grocery benefit program. There's a lot of direct improvements when it comes to not just an individual's health, but also the community. You know, when you strengthen the community by giving back, 60 to 70 cents out of the dollar from what you're purchasing, you're talking about improved school systems, improved health in that community. Just the foundation of the community improves when you're bringing back dollars to that type of local institution of retailers. And that creates jobs. So you're doing a lot just giving back to the community when you feed that benefit to where you're born and to where you live. But then there's other direct related improvements when it comes to an individual's health. Food insecurity is one of the biggest issues that are being tackled by the whole program of the social determinants of health, the SEN network. Something that SOMOS Community Care is actively trying to do, like Stephen had mentioned. Food insecurity means access, affordability, and that's something that's under attack even now with the whole EBT and the SNAP benefits being taken away. OTC benefit can really improve a situation like that. And then also we see, directly on the medical component, improved uncontrolled diabetes amongst the population, improved cardiac disease, improved obesity. These type of situations, if patients don't have that access to these to healthier foods, we see bigger issues when it comes to their health, and that factors into more hospitalizations, more urgent care interventions being needed. And what that ends up doing is it actually ends up overloading the healthcare system, which is already overloaded. And some of the local hospitals that are understaffed, that may be overpopulated with patients. We have some patients that may be going for, very basic needs that could be handled with an OTC benefit, such as, cold, allergies, gastrointestinal issues. If we educate the population and we promote things like the OTC, people can learn that, many of the things that may lead to a hospitalization can be handled with something as simple as allergy medicine from someone that supports the OTC program. So I think communities, we as a community and as individuals that can empower our communities, we should be informing the population that this is, something that can be utilized to mitigate, potentially a large percentage of the healthcare issues that we face.
So what I'm going to do is after every panelist speaks, I have a question for them. So we're going to put them on the spot, right? So, Dr. Talaj, so given your experience with both SOMOS Innovations work in the community-based health and with identified health, telemedicine, and e-pharmacy innovations, how can OTC grocery benefits be integrated with digital health platforms and community networks to boost utilization and improve health outcomes among undeserved populations?
So,
I sounded intelligent there.
I think with the wave of digital health, of digital tools, AI, digital healthcare, I think one way that it can be utilized to increase accessibility for the population is, currently, from what I've seen, I'm working on a platform at SOMOS Innovation to kind of unify members, hopefully the majority of the 2.5 million that are present, under one kind of umbrella so that they can be informed of where are these food pantries, where are these grocery stores, where are these supermarkets, where are these bodegas that actually offer the OTC, that actually accept the OTC card. I had no idea that this bill was being passed. I was just informed about this today, so hopefully that feature won't be necessarily hard for individuals to find. But in the event, it's always good to utilize our digital tools to our benefit. And I think one of that is, I don't want to take the subway, travel to a certain place and find out that they don't accept the OTC card. And then take it a little bit step further, what products are available for the OTC at that situation? Maybe by using digital tools that can, real-time tell us this place has these products available. They accept the OTC ProHealth Connect card. You can come here, maybe even schedule an appointment. And I think that's the benefit when it comes to using digital tools that could potentially help out the members. Did I answer your question?
No, absolutely. I think for those of you who've been in healthcare just as long as Roger has been, approaching 40 years, I think we're going to have to celebrate his 50th soon, right? And Nemesio and myself, back then we never thought, hey, let's do digital, let's do anything, because the seniors that we were taking care of back then had no clue about digital or cell phones or anything like that, right? So yeah, I am dating ourselves. Like, we used to have beepers at a certain point in communication, right? Nowadays it's different. Our seniors that are aging in are tech savvy, right? They research, they look for stuff. So as we continue to grow in the healthcare industry, we have to adapt to the change. And change now is digital. Change now is access. And how do we do that? Through apps, through Google, right? So I think what SOMOS is looking to do now is take that large population and start integrating that into this innovative, member app, which will then really give them access to everything. And guys, we got to be part of the change. We shouldn't just be thinking about today. We got to think about the next, few months, next years, because it just continues to add the technology.
Can I give a fun fact about digital tools and the elderly population? I think in the New England Journal of Medicine actually came out with an article a couple months ago that the rhetoric that the elderly population will not be adapting to technology, should not, we need to actually slow down progress and concern of the elderly. What they actually discovered was that the elderly population that is more engaged with digital tools and digital platforms actually show less progression of neurodegenerative disease. So it's actually something that we should be promoting. It is a hurdle. It's a task to get the elderly to utilize these tools, but rather than keep them from them, we should be teaching them how to use it. And by doing so, we actually improve the mental health outcomes that they will maybe suffer down the road.
I just thought of a new company. I'm gonna create a training program for seniors and go to senior centers. So health plans will be sitting and we're gonna start talking about how you're gonna help fund this for me. All right, Gamma Care. I'm gonna introduce Nemesio Ortiz and give Nemesio an opportunity to, from a marketing enrollment perspective, about how important it is enrolling these members. You gotta remember, every health plan, you have your membership because these marketing reps are out there every single day informing seniors you got to enroll into a healthcare program. Without the marketing team, there's no membership. Without membership, then Roger can't talk about I got 700,000 members, right? So the marketing team is the biggest asset to a health plan. Marcelo?
Yes, correct. Thanks, Stephen. It is accurate that the brokers and the captive agents drive the membership to the plans. But what's more critical, where we need to morph to, is exactly what Dr. Talaj is talking about. And, like them or don't like the people in office, sometimes you have to tolerate what they're trying to accomplish and see where the greater good is in that mission that they're doing. Current state, Dr. Oz, in conjunction with Kennedy, is trying to figure out with this whole Make America Healthy Again. There's some good concepts in there, right? Sometimes it's not what you say, it's how you say it as well. But there is some good content in there. And what they talk about is with these distribution channels, whether it's an internal or an outsourced entity that's bringing the people in, it's how do you educate them? Exactly what my panelists here are saying. How do you educate them on that? With us or with the captives, we see these individuals just as often as the bodega member sees those individuals, right? The number one reason why these carriers struggle with HEDIS measures, right? Those are the services that need to be performed that show that the insurance company is doing right by that member and that member's condition, right? So for example, if you are enrolled and you're diabetic, you have to have an A1C testing done, right? You have to have a podiatry visit done. You got to check your vision. That is how the managed care company can pick up on other illnesses at an early stage to be able to do some intervention to avoid that diabetes from progressing, right? So when we talk about the enrollment perspective, we really need to change that narrative. And it starts at the top, right? I have over 900 agents out in the community, 500 actively almost every day enrolling people. And what I'm telling them, it's not about that dollar. That dollar will come if you do the right thing. It's about servicing that member. So if I enroll Roger, it's about now making Roger aware that you're diabetic, and as a result, you need to go see the SOMOS doctors, and this is why you gotta go see them. And top of that is educating them on how do you stay healthy, or where it starts. It starts off with healthy eating. How do you access healthy eating? Someone who's making $800 a month and is surviving on that and is now being given $200 to $300 allowance to go purchase food, that's a big deal. That's a really, really big deal. To Stephen's point on how well the store knows the clients, he is correct. Because I remember being as a kid, I grew up as a Medicaid beneficiary, and I remember going to the grocery store, and what would I tell them? Dr. Ponte will appreciate this because this is a Spanish Harlem term. You go to the store and you tell them, apúntalo. Apúntalo. That means mark it down, that I will pay you when I get paid. And it was normal, right? That's how well the supermarket knows these members. So from a marketing and enrollment perspective, I've been on my, and Roger knows this, I've been on my campaign saying it's not just enrollment, it's managing that member. And how do you get that member? How do you manage that member? Let them know their access. How do you get healthy food? From there, how do you get to the doctor? And that's where transportation comes into play. And then when you're at the doctor, what it is you need to do while you're there. We're about to embark with one of the bigger carriers in the New York market. We're about to embark on a pilot program that I am super excited about because it's just that. So if you're my member, I know exactly what you need to do based on your age and based on your own personal record. And then I'm going to be able to sit there because I'm the one, not me personally, but my organization will sit there because we're the one that enrolled you, so we know what medication you're taking. And now, because you're my member, one carrier is going to give us the information specifically and say, Mr. Rivera, you need to go do an A1C testing. Mr. Rivera, you need to go check your podiatry, go to your, check your foot out, go to the podiatrist for a visit, and we'll be able to coordinate with the transportation company to get them over to the doctor. What that does, not only does it create, which is the ultimate outcome, create a healthier beneficiary. That's really the outcome. But what does that also do? That improves the score of the member with the carrier. The carrier, in turn, gets additional revenue to take care of that member, and with the surplus, can add better benefits to that member. So it's like the circle of life. And where does it start? With the education component. And right now, the education component is the enrollment person, whether it's outsourced or done internally. But what we need, and what I'm here beating the drum on, is we need the support, the data, to be able to connect all those dots between the carriers, the doctors, the beneficiary, and which is the conduit? The person that enrolled the person, that enrolled the beneficiary. That's where we need to morph into in order to ensure that we create this ecosystem that's good for the community and good for the health outcome of the member.
Wow. That's why I love this guy. I've known Nemesio for many years. And it's funny, I had a question for him, but guess what? Without even knowing the damn question, he answered it already. You know, part of my question to you, Nemesio, was being, that Gamma Care, is a large FMO and has such a large membership. What would you do to, I'm sorry, what would Gamma Care do to help increase awareness and participation in the OTC benefit? But he just announced that he's going to be working on a new initiative, a pilot that's going to kind of aim towards that. And actually, that's what I was trying to aim at. With a population that he has of 61,000, seniors, is what are you doing with that population? What are you going to, start, enforcing, that knowledge? Because knowledge is power, right? And one of the things that we understand with our seniors, whether they're at a medical office, right, or they're at a supermarket, right, we need to start getting our seniors, our members, fully aware of what they have access to, what's their benefits. I don't care if it's a broker. I don't care if it's a medical practice, right? Like Borinquen Health, a transportation company like First Class, or a supermarket. We are all touching the same senior. So there's no reason why we're not getting them information, keeping them engaged, and letting them know what's happened. So Nemesio, in 2026, what else, if you want to add one more piece, what else can you do to get more awareness?
It's working more collaboratively with the carriers and getting them, no offense, getting them to see the bigger picture. When you're an entrepreneur, I'm passionate about the community. Like I said, I was raised as a Medicaid beneficiary. I was born here in Puerto Rico and went to New York, Medicare beneficiary, worked my way up. It's really getting the carriers buy-in, which is why I spent so many years at, not to plug in one carrier over the other, which is why I spent so many years at the carrier that I did, is because they're a non-for-profit. For me, it's not about the money. It's not about the money. It's about the mission. It's about the mission. I was born with an extra pathway of nerves in my heart. And you know what they told my mother when I was a kid? Because I was a Medicaid beneficiary? Don't expect a long life expectancy from this kid. Right? Meanwhile, as I became an adult and I got commercial insurance, they figured out what was wrong with me. But not what was wrong with me, what was the defect? Ain't nothing wrong with me.
I ask that every single day
But
when he calls me. Okay, but go ahead.
So it's about the mission, right? And created that awareness to a kid that was not supposed to have a life expectancy, went to the Marines, meritoriously promoted, worked my way up the ranks, started my own company. And it's that awareness that we lack. In this particular scenario, is the awareness to healthiness, right? When I think back of my parents, I can show you a picture of my father when he was my age. The man looked 90 because they weren't aware of healthcare, right? Shooting himself up with diabetes. At the age of 38, my doctor told me, you're pre-diabetic. I lost 70 pounds, worked out. Why? Because knowledge is power. And that's really what I want to get to in 2026 is get more buy-ins. I got my first 500 clients coming in to get them into that test program. I want to show that through education and you telling me what my member needs, that I can guide that member to get the service, to go to Borinquen and get those services done, to go to the SOMOS doctors and get those services done, because we talk to our members on a regular basis. Let us be the conduit to drive that message that's going to feed the ecosystem so that we all do better as a community. So that's the goal for 2026.
Thank you, Nemesio. Now, next, Roger, I got to ask, who's your photographer? Because you look...
That was done for the website for my company, so they brought it up.
I'm going to get that photographer. I need it. Wow. So Roger Miller and I go way back, you know. When I was at Lincoln Hospital, I was in charge of Lincoln Hospital and of the Child Health Plus program. And that was like my first taste of marketing. So I worked for the hospital. Our goal at the hospital was to make sure that every child had insurance. And for those of you who knows what Child Health Plus is, I don't even know, is this still around?
Yeah, it is.
Yeah, okay. I'm sorry.
Kids need insurance.
Yeah. No, I didn't know if it's just now the essential plan.
No, it's still there.
Yeah,
No,
okay.
no.
But Child Plus was basically like we at Lincoln Hospital, those who know Lincoln Hospital in the Bronx was like, okay, let's take every immigrant here and give them health insurance, you know, every child, you know, leave no child behind is what the term we used to use back then. Mm-hmm. And what I did was that I hired interns to work for me at the hospital, and I put them inside the medical office. And every time we saw a parent come in with a child that had no insurance, we were like, "Oh, you need to go see the staff member here who's going to help you." So they were like, "Okay." And when we would see them, we would enroll them. Roger Milliner wasn't at Metro Plus; he was at another health insurance. And Roger comes to me and says, "Steven, listen, I'm going to assign one person to you. I'm going to do this." He made me feel special. And by him making me feel special, instead of me pushing enrollments to Metro Plus, I was pushing it to neighborhood health providers. And I don't know. A year later, he got a job at Metro Plus running the damn health plan, you know? I guess they needed to take him out, right? But there's one thing I have to say about Metro Plus and what I've known about Metro Plus. It's the only health plan in New York City that has all full organic growth. They've never purchased a health plan. They never purchased a membership. It has been straight direct with the city hospitals in New York, expanded out into the community. And I commend Roger, who's been managing that over 25 years, right? Full organic growth, which you don't hear that when it comes to a health plan. Roger?
Well, it was all through the partnerships with organizations like yours, working with great broker agencies like Nemesio. And we really are partners. A lot of times it may seem like we're a little sort of fragmented, but behind the scenes, the health plans, the providers that's in the back, you know, organizations that Steven run, we really are connected and unified. So I just want to give us all a moment of silence for that. But like we're dying. But to Nemesio's point, we're talking about that surplus. The surplus. That surplus money that we get after, you know, we go through our bid process with CMS is what allows us to determine what we're going to use the rest of that surplus money for. And believe it or not, the OTC benefit is the most demanded supplemental benefit that comes out of the mouth of the population that we serve. And just so you know, this is not a New York City thing. This OTC benefit is popular across the whole United States. So I go to conferences all the time, and everybody's talking about, well, what are you doing to attract more Medicare recipients? And everybody's talking, and universally, whether it's California, Chicago, wherever it is, everybody talks about the OTC benefit, and has revolutionized the supplemental benefit, package for seniors all across the country. But back to New York. So we took it a step further and not just made it an OTC, but we added a flex component. I think Steve was alluding to this earlier, that in addition to be able to get your OTC items like your Tylenol and your Band-Aids and stuff like that, we wanted seniors to have the ability to be flexible with what they can use it for. So we added that they can actually pay their utility bills. So some seniors will take some of that money on that OTC flex benefit and they'll pay utility bills. Others will go and buy bathroom safety items. Others will take it for groceries, as Steven said. So that ability to have that flex component has been very, beneficial to the OTC program. We do partner with all of the local retailers that Steven mentioned, like the Bravos and the C-Towns. We're actually on site at many of those locations, working hand in hand with the grocery store owners. We have digital signs in their stores. We have posters that brand how the seniors can use it and what they can use it for, and that's been very helpful. It started out as a benefit only for seniors, and then a couple of years ago, the industry got smart, and I ain't gonna lie, I actually took that from one of my colleagues in the back. They were doing it, and I was like, oh, shoot, I got to jump on that. So there's only 3 of us, 3 health plans, right, Gio? I think that offers the OTC benefit, and Gio's from United. I'll give her a shout out. We work together. Even the health plans that compete against each other, we are friends. And we were out one day, and she told me about that, and behind the scenes, I was like, ooh, G doesn't know. I'm about to go get that. I know she hates me. I should have never opened my mouth. No,
And, and they all use me when I take them out for drinks, you know?
Right. Well, well, for y'all don't know, he throws the best networking. This is the glue to the whole healthcare CBO partnership in New York City. Steven throws the best networking functions at restaurants and sporting events and stuff. And we all get together and we share ideas. So we really don't compete. We're friends behind the scenes. We're competitive, when we have to be competitive. But Steve, you've done a great job in bringing us all together.
Thank you.
But the OTC, yeah, for real. You got to give you your flowers on that. The OTC benefit, we took it to the next level. We now offer it to the Essential Plan members. So, and if y'all don't know what I'm talking about, for people who get their insurance through the Affordable Care Act, some of them are eligible for Medicaid, some are eligible for the Essential Plan, others for QHP. And we decided to add the OTC benefit for Essential Plan members, and that has really taken off. So, and at this time that we're in, where people really can use it to give somebody an additional benefit that they can go out. We talked about food insecurity and the fact that the SNAP is under attack. He's right. This benefit is really helping people out. We've even used these local grocery stores. Metro Plus has made a campaign of over $250,000, $250,000, just to supply our own members with those benefits that they used to get from SNAP. Because what's happened is I reached out to Steven not too long ago. I said, I need the contact at the local, that we can buy foods from. And we've been working with them to buy the items so people are going to be able to come to our community offices and get some of the things they used to get on SNAP right out of our community office. And we can't touch the, $65 million, somebody said, another panel that is being spent on that, but it's a start. You understand? And my CEO is committed to us doing that on a regular basis. So the OTC, which is what we're here today to talk about, has really been very beneficial to help people with wellness and things of that nature. We're all about wellness. And this is just yet another wellness benefit that we offer. We offer a $500 per quarter benefit. So imagine a senior who can get that's a lot of money. That's changing, the lives of some people. $500 a quarter, that's $2,000 a year that they can use this OTC Flex benefit for. And on top of that, they get another $450 in rewards. So it's only $2,450, a year on benefits that they can actually do something with.
So Roger, a quick question here. So Roger is the Chief Growth Officer, right? So I got to put him on the spot about how he grows his membership, right? So Roger, what do you think in 2026 is going to be your most effective campaign to help increase the diverse membership you have right now in Metro Plus?
It's partnerships. I was in a panel right before this, and it was a array of people from providers to CEOs of hospitals, the CEO of the United Way, and a couple others, a union. So the one thing that I've learned, and I think I even learned this from Stephen, I started out before him, but I actually got better because of some of the times we were together and we were brainstorming, is partnerships. My strategy going forward is going to continue to build alliances with organizations that think like-minded. Nemesio is always calling me, hey, Rod, I got this new idea. What can we do? And so we have to be able to not see ourselves as competitors, but as partners. I mean, we are all, you said it, we're all touching the same clients. The borough president's office in the back, they're very supportive. The Bronx Borough, I actually have a meeting with them on Tuesday. It's because we have to leverage, elected officials. We have to leverage providers. Dr. Aponte in the back. So it's you said, well, I shouldn't be saying this. 'Cause I got Gio in the back. She's probably texting her boss behind the scenes. This is what Roger's talking about.
I think Gio has a meeting with the borough president office on Monday now.
Right.
She just
That's how it works.
Yeah.
That's how it works. No, but partnerships and collaborations is going to continue to be my strategy. We are local. Gio, no offense, right? I don't have the distraction of being a national.
Yeah.
Where they have to worry about shareholders and profit margins and all that. We are not for profit. We're part of the New York City Health and Hospital, which means I work for the city of New York. We have to rely on partnerships here. And so that's what I'm going to be focused on, to continue to build. I met a lot of great people from new organizations by coming to a conference like this. I learned about this conference because of Steve, and I started coming every year after that. So it's all about partnerships and collaboration.
Thank you, Roger. And we saved the best for last.
No pressure.
No pressure. Listen, we wanted to incorporate Puerto Rico into our conference. We have a very special guest. I had a chance to visit when we brought on her network of pharmacies into ProHealth Connect about 2 years ago. I came out and I could not believe what I saw. If I'm not mistaken, I think you guys took over former Rite Aid locations because they're huge. And the first thing I saw, I was like, wait a minute, was this a former Rite Aid's? Because it was huge facilities and they have large facilities. But before I turn it over, I have to say, two very important people just walked into this room, all right? And I have to, Willie Walker, for those who know Willie Walker, and Kyle Bragg. It's my big brothers there. They're my mentors. Whenever I want to say stupid shit, I talk to them first, and they'll tell me not to say it, right? But but I say it anyway. Just in a different way. They've been very instrumental. We launched a pilot program last year in the city with the migrants, where we provided a card that allowed them to purchase prepared foods at restaurants and at our supermarkets. We did a very great job. We're hoping that now, because of the success of that pilot program, where we saved the city 8%, and we taught the participants how to budget themselves on $11 a day to eat, right? And we still save the city 8% on top of that. So we're hoping that maybe with the new elected mayor, we could launch this program across the New York City with the shelter programs. Ingrid, I just had to. This is what you call the OGs. You got to give them the respect first, But now I'm going to turn, as Willie would say, I'm turning it over to, someone more important, a very pretty person here who is going to bring light to this conversation about the farming perspective, right? And what they're doing here in Puerto Rico to provide service. Ingrid?
So first of all, there's, like mentioned Stephen, we have 10 chain pharmacies in Puerto Rico. So we're very proud of servicing a lot of patients here. And it's a local pharmacy. So that makes us very proud too. I want to provide like a overview of Puerto Rico. When we think about the economic part, we're between 42 and 43 poverty level in Puerto Rico. Our population of 65 years plus is increasing rapidly. So here is where this kind of benefits comes to take place, and an important and an essential part of the health for these patients. I think if you ask me for a word, it could be maybe a game changer, right, for these patients. So definitely, when we think about the need that they have, the pharmacy comes to be accessibility. I think that's a word that was repeated during the conversation that we had. Here in Puerto Rico, it's a small island, as you can see. So the pharmacies are very close to patient homes. So they feel like the pharmacy is like an extension to their homes when they are looking for solutions in terms of their health. So we have a very big responsibility of educating the patients, providing information about OTC benefits and changes, because sometimes these benefits changes year through year, and this brings a lot of tension for patients because they don't know what's coming, how much is going to be their benefit. So definitely they rely a lot on the pharmacy. I think this is a trust relation, very strong between us and the members that we serve. And usually if you see them, like someone mentioned that you see them every week or more than going to the physician. So that's very true. When I visit our pharmacies, in visiting them, I see the same patients often. So it's, as I mentioned, they rely on us, on our pharmacist that can help them through using the best OTC options for what they need, the symptoms that they have. If something is interfering with their prescribed medication, so there's support on that part. But also they feel like with the pharmacy staff around, they feel that trust also, on providing the orientation that they need. So our commitment from the pharmacy staff point of view is to better understand every year what changes are coming so we can provide that information to members. I think that also other point, and I have notes here because I don't want to miss any information. There's another point of reducing economic and social barriers. Many patients, face financial barriers when trying to access healthy products. So OTC and grocery benefits helps reduce these challenges by making it easier, right, to purchase items that directly to contribute to well-being. And then there's another point that I think the doctor mentioned too, and it's preventing, right? Preventing health, promoting preventive health. So through pharmacy counseling, like I was mentioned from pharmacists, and follow up every time that they visit our pharmacy, display a really active role, right, in disease prevention. So there's also a commitment on keeping our patients' health and prevent, like we mentioned before, ER visits, complications for patients. So definitely it's a collaboration process between all of the involved parts to keep our patients' health and support them on all the education that they need.
I enjoy spending time with my network, speaking with the leaders because they understand the community, right? They understand the members. Better? Okay. When you have a chance to really sit with your network, and I like spending my time, speaking with owners and the pharmacies and the supermarkets, right? And even the bodegas, it's important because you get a better perspective of what's going on, right? We may think we know what's going on, but you got to sit with them to really understand what's going on, right? because we are focused on making sure that people have access, right? The health plans, you're making sure that there is a benefit, right? And the Mesio is making sure that there's people being enrolled to get the benefit. But then there's the people who have to actually provide the service, and guess who they are? That's our independents. So it's very important that you spend your time and understand. I would suggest to the health plans, have more focus groups, bring in your networks, sit with them, have a better understanding of what their day-to-day is and what your members are going through. And with that said, just Ingrid, from a from a pharmacy perspective, what else do you think you could do differently to kind of help improve the access of care with your members?
Actually, in my role in Olivia, I'm the relationship director for the pharmacy. I worked very close to payers in Puerto Rico. I think that the communication, and we mentioned a lot the collaboration that we do with them, it's crucial to better understand what's coming. As I mentioned, every year there could be changes along OTC benefits amount and the impact that this can have to patients. So definitely we have very close communication, and we have continuously meetings with payers to better understand what's coming. Right now, we're in enrollment period in Puerto Rico. We have meetings, and we have a very structured communication with them to better understand what are the changes, how we can communicate the changes, what we can do internally to have medications with a better cost, for example, so it doesn't impact that amount that they have, that sometimes is less. I mean, sometimes the OTC benefits next year could be less than this year, could be more. So depending on that, definitely I think the collaboration that we have with them, and I think that the best word is to be an advocate, right? We need to be an advocate for our patients, to have a strong, and I worked every day to have the better relation with managed care organizations, so we can align on new strategies, on what's coming, so we can better support our patients from that side.
That's amazing, and they continue to grow. It's just, I've seen what you've done with your organization and what you've done in Puerto Rico, and I think it would be great for us to continue working with the health plans that that are national and that accept you here in Puerto Rico, and even good to even fly you out to New York so you could kind of get an understanding of what we're doing in New York City and how they're working closely with the health plans and the members, so that you could take some of those best practices and bring them here to Puerto Rico, because that's the key, right? It's about sharing that knowledge, making the connection, showing them, hey, what we're doing. So I'm welcoming you. I would love to fly you out there, bring the other executive staff too, and we could engage and kind of see how can we bring best practices. Wow. I have to say it's a great conference. I would like to now, we don't have that many minutes left, because I had 3 guys that are marketing people here on this table, so we love to talk. So we kind of ate away at the Q&A, but definitely want to open up 1 or 2 questions. Dr. Ponte?
Do I need a mic? I mean, I don't need a mic, but do you want me to use a mic for this purpose, or? All right. So thank you guys very much. I want to highlight a couple of things that you said. So I'm Dr. Adam Aponte. I run the East Harlem Council for Human Services. We run an FQAC in East Harlem called the Borinquen Neighborhood Health Center, like the original name of the island of Puerto Rico, Borinquen. A lot to unpack. We don't have a lot of time, as you mentioned, Stephen, but a couple of things you mentioned that I want to highlight. First of all, the spirit of collaboration is something we have to emphasize in medicine. The problem in medicine is that we're too siloed. right? We see each other as competition, not collaborators. So I'm glad that you guys, each of you, emphasize the need for us to collaborate and not look at each other as competitors. And I know this personally because I know that, you know, United Healthcare hangs out with Metro Plus and Emblem. George Hulse's not here, but we know that all of you guys are thinking about how we're going to best serve these underserved individuals. So kudos to you guys for embracing that spirit of collaboration. I think we have to really shine a light on that. The other thing I want to talk about, first of all, seniors don't like to be called seniors anymore. They like to be called older adults, or in our senior center, they like to be called recycled teenagers. And then the question for you, with the OTC and the Flex in particular, Roger, I know you guys are allowing groceries and food to be bought. We also know, and I support the bodegas, obviously their local economy, we're big supporters of the local economy, but we also know that we don't get the freshest foods in bodegas, right? And so how do we still utilize the bodegas, but help them to make sure that they bring in fresher foods, more healthier foods? Food is medicine, we know that, right? And so how do we help them to make sure that they fill the shelves with the foods that our seniors, our older adults, our children need, so they can actually be healthier, right? Because the canned goods and the, you know, the...
I'll answer that. And it kind of was on the slide that I provided before. The OTC grocery benefit is a $18 billion program. When you take all the health plans across the United States, when you take the membership, and when you take the OTC grocery spend, we're talking about $18 billion. Now, I'm talking about all 50 states. I'm talking about all membership. What I showed you before is funneling that money back into the community. We have to do a better job, and the health plans have to start by enforcing that knowledge to their members that there is a independent local network that can service them. And what happens is that if there's more money going into Ingrid's pharmacies, then that allows her to purchase more of the products that will give those members access. So we talk about that recycling component. Guess what? They can only serve and give better products, Dr. Ponte, if those members are actually coming in and using that OTC benefit there and not using it at Walmart, or, you know what, I'll put it on the health plans. The biggest thing, I know that the health plans want members to have more access, but guess what? When you give them access to Amazon, then you're taking away from the independents. So I want the health plans to start thinking correctly that if you're saying you're a community health plan, come on, give back to the community then. But when you start giving that same community access to Amazon, then guess what? You're actually hurting the same community you say you're hurting, all right? So that it's a very important, and I know you guys are doing it because you guys contract with Incom, you contract with Solutron, you contract, guess what? You gotta tell them, hey, come to my community. You have the power and control to say who you want in and out of your damn network, all right? So think about the independents that you're out there marketing with. You're putting your table in front of their location. You're not putting your table in front of Amazon. No, you're not.
Well,
And
the biggest spend, believe it or not, on that benefit is for groceries and food and stuff. So even though that flex is there, we see the percentages of where it's used. It is mostly used.
but it's where it's being used. And where it needs to be used is in the independents. Yeah.
And I think also to piggyback on that, it's also about accessibility. Maybe these members don't know that there are cheaper, healthier options in the community that can give them access to this rather than going on Amazon, for example. So if we had, again, to the question that I got from Stephen, a digital tool that, you know, can show a member, hey, you have a bodega here that is available for you right now with what you need. You know, they'll go there rather than think, oh, I have to go a strenuous route. Let me go on Amazon. That's simple, easy. You know, let's show them that it's also as simple and as easy to access that same need in the community. You know, so I think that's where the difficulty lies. And, you know, when as a culture, if we're training.
At the local places like the Bravos and the C-Towns, the card is not limited to only the canned goods. You can get fresh produce from there as well. So I think that was what your question was,
Yeah,
right?
so grocery stores tend to have
Yeah.
more fresh foods, right?
Yeah.
You know, our communities live in food deserts. There are not a
Yeah.
lot of grocery stores,
Yeah.
so they rely on the
The
bodegas.
bodegas, I
And
hear
the
you.
bodegas don't have
Yeah.
fresh food.
Which is the reason why I met with the local city officials, Councilman Kevin Riley, Councilman Christopher Marte. They are taking lead in this particular bill because it's important that the bodegas participate. So because they've been scammed by other programs, they're very hesitant to joining the ProHealth program because it's like, wait a minute, you're giving me this for free, this terminal's for free. You're telling me that people are going to shop here for free. Like, this doesn't make sense. So by passing this bill in New York City, this is going to make it much easier for them to understand that this program does exist, and that the city is backing it up. When that happens, then we could push more products. And I'm hoping that we could then work with the health plans to educate our bodegas to now invest in better products, right? To give to the community. But to invest means you have to what? Have a return on investment, right? So if they go out there and start getting all these fresh fruits and vegetables like Dr. Ponte is saying is needed, guess what? We better hope that the health plans are sending the members there to buy it, right? I see one last question and we'll take.
My name is Ana Jacobo, and I'm the chair of the Mary Mitchell Family Youth Center, and we have farmers markets, and we have receipts, and we do prepare menus, and we give it to the patient, not the patients, the elderly, the seniors, and we provide them with healthy bags of food, and I think that is an enhancement to the bodegas because it's the people from our community that benefit from that, and I have to thank you guys because it's essential for us to continue to have those.
Well,
Christine.
oh my God.
Give a shout out. Another, I won't say OG because she's so young. OG respectful.
I like you better.
OG. A goat in the business.
Yes. So,
The president of Lincoln Hospital.
yeah. She was young when I was there, okay? She wasn't the president of Lincoln Hospital when I was there, okay? But I want to thank everybody here. I know people want to probably go to the beach, want to enjoy the rest of the day, go have lunch. I want to thank every one of you for being here, listening to us talk. Hopefully we walk away out of here. We have several health plans here that you go back and you start saying, we got to do something different, okay? Thank you, everybody.